Hi, I'm Dr. Olga Shvab, dermal fillers expert and advanced techniques trainer. Today I'm going to share with you with my patient's mid-face correction with unmatched Juvederm. I will use today 3 syringes of Juvederm Voluma and 1 syringe of Juvederm Dermal. Let's start with patient assessment. This is my 37 years old patient, and she says me that she's not satisfied how her face looks like in the mirror. Her face looks tight a little bit and unhappy, and skin is saggy, so we need to do something. Basically, we can divide the face into 3 parts, from the hairline to the glabella, from the glabella to the base of the nose, and from the base of the nose to the base of the chin. Normally, all these 3 parts, according to golden ratio, should be equal. In this case, you can see that the mid-face is the longest part on her face. It means that we can make illusion of shortening this part. We can elevate the cheekbone area, and we need to shorten this part also. You can see that in this case, this part is the longest part, the central part, and we need to make this visually shorter. To achieve this goal, we need to elevate cheekbone area and make it a little bit more prominent, and also this area we need to elevate it. Also, we can divide the face into vertical fibs. Each of these fibs should be 1 eye width. And we can see the same problem, so we need to elevate a little bit cheekbone area and add volume to the temple. Now I will ask my patient, look to the ceiling please, now look down please, and now look into the camera. We can see presence of anatomical tear trough, lateral lid-cheek junction and also mid-cheek groove. We know that here is orbital retaining ligament, here is zygomatic ligament, and we can see here is mid-cheek groove, here is anatomical tear trough, and here is lateral lid-cheek junction. Because of these ligaments and tissue sagginess, we can see here is sausage effect. Also we can see heaviness here and depression here because of volume loss within the age. Also we can see depression here and descent of the brow because of volume loss due to fat atrophy within the age. I will inject the main lifting points here. Here will be the first point, here will be the second point, here will be the third point, here will be the fourth point, and also 1 point here and 1 point here. This is CK1, CK2, CK3, this is nasolabial point, this is T1, this is T2, and also 3 points to improve this area. This is TT1, TT2 and TT3. This is the part of Mauricio de Maya endocord. Before you start injecting, please keep in mind the dangerous areas. The supratrochlear artery, here is the supraorbital artery, here on the mid-papillary line, 7-8 millimeters below the orbital rim. Don't forget about infraorbital foramen with infraorbital artery. The next anatomical landmark should be mesenteric muscle, and also please smile and relax. Here we can palpate modiolus. Here is the point where all muscles of this area come together. From the zygomatic bone to the modiolus, zygomatic major muscle running. Medially the mesenteric muscle, the facial vein is running below the zygomatic ligament, and here is running in the inferior border of the tear trough, and here it becomes the angular vein. Facial artery is always medially the facial vein, goes deep under the zygomatic major muscle, laterally to modiolus and always fixed to it. Then mainly it goes from the depth above the levator labia superior. And now the temple. We can palpate temporal fusion line, and also we can demarcate the orbital crest limits and zygomatic temporal fusion line. This is the borders of temporal fossa, and we also need to palpate the artery here, the forehead branch of superficial temporal artery. It's running here, so we can avoid it. Our main points here will be 1 cm up for the temporal fusion line and 1 cm down here. This is the main injecting point here. This is T1, and also we can inject here 2.5 cm lateral to the lateral canthus and 1 cm up. I will start with the first lifting point. Here we can palpate the notch. Here is the zygomatic temporal suture. We can pull the tissues away, inject the needle deep down to the bone, and we can make aspiration. Wait 3 to 5 seconds, allow blood to come, and then inject deep. 0.1, 0.3 cc in this point. This point will give support to eyebrow and inferior eyelid. You can see we need to mold the product laterally. And we already can see the first lift effect. The second point should be here, a little bit medially from the last point. This is CK2. Also 0.1, 0.3 cc in this point. And again mold. Here will be the third lifting point. We will go down. Here we will inject to improve the tear trough and also the mid-cheek groove. We should inject 0.1, 0.3 cc in this point. We need to mold in this direction to improve this part of the tear trough. The next point will be here. This is T1. This is 1 cm up and 1 cm down from the temporal fusion line. We need to make aspiration here and then inject deep. 0.1, 0.3 cc of Juvederm volume. You can see the great lift effect in this area, the elevation of the brow, and also the temple area become better. The next point will be here. We will go down below to the deep temporal fascia, in the deep temporal fat compartment. You can also make aspiration here for safety. You can inject here 0.1, 0.5 cc in this point. This is TT2, 0.1 cc. This is TT3. You can inject 0.1 in this point also and mold. and TT1 0.1 cc. That's it. The nasal labial point should be here. We can pull away the ligament and the artery goes here down to the bone. Aspirate and inject 0.3 cc in this point. You can see the great effect on the treated side. Here is the major area of improvement. There are no more mid-chair groove. Also, we can see improvement of the tear trough and lip-cheek junction. There are no more sausage effect here, and we can see elevation of the eyebrow and the lateral contours, and this area becomes smoother. Also, we can see the lift effect on the lower face. Smile, please. Big teeth. You can see the corner of the mouth on the treated side goes up. Relax. It means that these points affect this area too.